Yeah, that is incredibly distressing and incredibly concerning. Obviously, there was a misidentification that happened there between police. There is now a health inquiry going on, and we need to really get to the bottom of that. That is incredibly distressing and worrying. You identify with what is a horrific set of circumstances that has happened, and it's just incredibly distressing and concerning. Massive amounts of empathy and concern for her and her family.
I think it's a really concerning situation. I don't want to politicise that because I don't think the current government of the day have any responsibility for that. It's clearly a major mistake, and it's one that I think the appropriate bodies need to get to the bottom of very quickly to identify exactly what happened, how that happened, and make sure that it can never happen again.
Oh, look, it's incredibly challenging. We have workforce shortages in specialist areas in a number of places across our healthcare system, as you're aware of. With respect to palliative paediatrician care, it's incredibly challenging across the country. It's not just in Starship as well, and I am aware of that issue. Starship have assured that they can try and backfill with clinical support. Ultimately, we've also got to try and do a better job of trying to attract people to New Zealand that actually can do those jobs. There's a shortage of those skills across not just in New Zealand but around the world as well. But yeah, it is incredibly challenging, and it's a symptom of actually some long-standing challenges we've got in a number of health workforce areas which we're trying to work on.
Yeah, again, I mean, I wouldn't hold the ministers accountable for the fact that they weren't advised, but I think it is very concerning that they weren't advised. I think there's been clearly a catalogue of mistakes here, and I do think the New Zealand public deserves some reassurance that they've identified how that happened and that it won't to make sure that it won't happen again.